All right, hello there, and welcome to the beginning of the Independence Day weekend. I'm J.R. Lewis. This is your daily briefing, Friday, July the 3rd, and we take a break from visiting with the mayor and shift to the doctor. Dr. Hannah Sanders. I always goof that up. Dr. Hannah Sanders is our guest today because, you know, this is a medical thing, and it's nice to hear from a medical expert to get her views and recommendations and observations. So that's what we're going to do on this program. Heard in the 1 p.m., 5 p.m., and 8 p.m. hours on the radio, and then archived at youtube.com/Cordova TV if you would like to hear one later or share it with somebody else. So let's visit with the good doctor on this Friday program. Dr. Sanders, it's been a while, which I guess is good in some respects, because most of the time when we talk to you, it's because something's on fire. But it's kind of nice in a less pressure situation to get the variance of your views as we do these briefings. And I'm wondering, as a doctor, as you hear the news coming from around the country, new record cases, numbers of cases, daily cases, and in the state too, of course, where we've gone from a point where we were at 1 or 2 a day to 30 in some cases. How do you look at all of that from your position and your experience?
Well, in terms of looking at the cases as they're rising, I think as we see people's activity increasing and people are becoming a little bit more bold in terms of their willingness to participate in social events and be out, not always wearing masks and not always practicing good social distancing, we do expect to see those cases rise. So it definitely is concerning. We also expect to see cases rise as we increase our testing capacity. So we are hopefully capturing more of the early cases and isolating people. So those two things together, we do expect the numbers to rise. However, as cases are increasing, hospitals are starting to really watch our bed capacity, state ICU bed capacities, and making sure that we all are ready with our surge plans, have the increased staffing ability, increased medical equipment, and are ready for an influx. As we see that curve shape change, it makes every physician across the country worry that we're going to overwhelm our hospitals.
Yeah, that was always the initial concern and the initial goal in slowing the spread. Were we ever really in a position where we were going to reduce the number of people that could or would catch the virus eventually? Or has it really continued to be all about making sure that the spread rate is below what the medical facilities can handle?
I think we always hope for both. You want to keep that rate below the hospital capacity so that we are able to manage cases. And the hope is always that we develop a vaccine or a treatment that enables us to stop the cases from spreading, and we don't have to have herd immunity, and we don't have to have everybody get this. I know we're all becoming a lot more comfortable with the idea, and young people are getting more comfortable with the idea of COVID because the survival rates, of course, we're seeing that they're pretty good, and 99% survival rate is an important thing to understand. But that also means that, 1 out of every 100 people that get this virus don't survive it. And that's pretty scary. That's still an incredibly high number. Young people do really well with this. However, the age group of 22 to 40-year-olds, about 12% of them end up in the ICU after developing coronavirus. So it's not something to put our guard down. We need to be very cautious and make sure that people are practicing social distancing and wearing masks, because this is a very dangerous pathogen that we're facing. Are
you hearing some of the same information? And again, I'm asking you as a physician, where voices are rising saying, yeah, it can be fatal and maybe it's not fatal, but it's having lasting impacts on people. that say something that may become more chronic, lung trouble, or outcomes that last beyond just a couple of weeks. Are you hearing some of those stories too, and what do you think about them?
Certainly. Well, this is a new pathogen that we really only have 6 months worth of understanding, maybe 7 months of understanding and monitoring. We don't know what the long-term chronic illness could be from this. Anytime, just like anything that you do to your lungs, whether it's vaping or smoking or have a bad pneumonia, that level of inflammation in lungs can be incredibly damaging. The damage that can be caused from the COVID-19 virus to lungs that certainly can cause long-term damage that some lungs might have a hard time recovering from. There was a case where somebody's already received a lung transplant after COVID-19 left their lungs to a non-functioning capacity. And so I think that just that case alone shows us that there is some evidence that the damage from the inflammation can cause chronic sequelae. There might be other consequences as well that we just haven't studied or seen yet.
Yeah, and I mean, I saw the photos of the lung that had been removed, and it didn't even look like a lung. It looked like somebody's liver that had been dipped in nacho cheese or something. It was just amazing. Very powerful visual. Well, thank you, by the way, for it's always interesting, as somebody who is forced to consume a lot of news, trying to separate fact from fiction is very challenging, and that's why I enjoy these conversations with you to kind of get a physician perspective. Let's turn to something of interest to local folks, and that's the restart of the ferry. What are you seeing as far as the rules in place for the ferry and potential impact for Cordova? Is that an area of concern, or is it something you feel the team is planned for?
I think that we're well planned for it. The medical team and the city emergency team, we continue to pivot as things change quickly, and we were ready when they had a pretty significant testing strategy for the ferry. We tried to prepare for that, and all were able to breathe a sigh of relief when we didn't have to do such extensive testing. For us on the medical team, we felt that the testing prior to boarding the ferry here was a little too stringent and didn't increase people's safety. So we were glad to see the state share that same sentiment. The ferry is doing a 5-question screening questionnaire for all passengers prior to being able to board. I did look at the questionnaire. I think it's good. I feel very safe with the passengers that will be boarding the ferry in Valdez or Whittier and coming here. They will be pre-screened and won't be increasing Cordova's risk.
All right. Well, we certainly hope that's the case. And, to brag on you and the local team, it's been interesting, again, comparing community to community, that really anybody under even those old rules that had wanted to be tested in order to be able to leave would have been fine. Here, it's just getting stranded other places that are not as progressive about testing as we are. So, again, let me toss my hat into the pile of hats that have been tipped to the hard work of you and your crew. I also, is there going to be a small change in the testing times that I hear about?
We are. We've been trying to adjust our testing times to meet what seems to be the best for the community and able to continue to get our results out quickly. Alonka is increasing their testing days to Monday, Tuesday, Wednesday, Thursday, Friday. So all weekdays you can go and be tested there from 2 to 3 p.m. CCMC we aren't expanding our testing time. We're still 9 to 10, Tuesday, Thursday, and Friday, but have expanded with the airport testing and a lot of processor testing that we're doing.
Yeah, that's right. And is the airport schedule still the same as it's been, 5 days a week, 2 days off?
So right now it is still 5 days a week, 2 days off. On average, we're finding about, on average, 30 passengers from out of state are arriving without tests, and we're getting those done here in Cordova. So I think we have a good strategy having those 2 days off, the people are still coming into town and getting the testing while getting the results to them quickly.
Good. Well, like I say, it's always interesting to hear your perspective on these things. Anything else, by the way, in terms of something you get asked a lot that it'd be nice for us to be able to tell a lot of people at once, or just anything else before we close out?
I think it's important to remember that the symptoms for this virus come on slowly. The people that are developing symptoms start with a very low-grade fever, and the largest amount of viral shedding that's happening is a day or two before that fever or those mild symptoms start to come on. So we really appreciate people wearing their masks. There has not been well-documented aerosol spread. So when we say that, it means that we're talking about the really tiny particles that escape from masks or are in building HVAC systems or in airplanes. Where we're seeing transmission is those droplet respiratory secretions, and those are captured by our masks. And this is showing to be a very effective way to slow the spread of coronavirus. So keep wearing your mask, keep washing your hands frequently, particularly after you touch your mask, wash your hands, and Cordova, keep doing what you're doing because we're really doing an excellent job.
Certainly seems that way.
Add one more shout out to the processors. I have been really impressed with how they're working and testing, and they've just made so many changes and adjustments this year. I think that they're really doing an incredible job trying to keep their employees and our community safe. And again, that same shout out to all the staff that's working behind the scenes to help us get ready for our surge plans. We've got facilities. People are building ramps, getting our equipment ready, we have been receiving a large amount of equipment in order to be ready to manage a surge, and that requires a lot of training and inventory and the things that are going on in the background to make sure Cordova is safe. It's really incredible to see everybody come together in this way. So the town has been able to kind of get into a normal routine with this while the medical teams are still working a lot of extra hours to be ready to tackle anything that comes our way. So I want to give a big shout out to everyone that's working on those efforts.
Yeah, well, it's a good group of people. The cross-agency work between CCMC and Elonka continues to be a great example, and a lot of things that are being done as a result of the pandemic that potentially have a future to stay in some improved form once we, God willing, get to that day where there's a vaccine or a medical treatment that if you have it, that it isn't worse than having the flu or having a significant cold. Doctor, thank you again so very much for your time.
Thank you.
All right, that'll take care of our July 3rd daily briefing. Big thanks again to the doctor for joining us, and we hope that was valuable information for you. We hope that the briefings in general continue to help you feel informed, and you can hear them weekdays in the 1 p.m., 5 p.m., and 8 p.m. hours. Also on our YouTube channel at youtube.com/Cordova TV. Don't forget covid19.cityofcordova.net for the latest online information about Cordova's response. 424-INFO if you want to be able to talk to somebody about how Cordova is responding or leave a comment for the incident management team. And Elonka's phone number at 424-WELL for a recorded update on some of the latest statistics. We'll look forward to seeing you again next week for one of these. Of course, if anything serious should develop over the weekend, we will jump right on that. But the regular schedule is weekdays. And so until Monday, we wish you all the best as you observe Independence Day.